Critical Thinking for Chapter 1.
Question: why is accurate coding important? Well, coding information is used in many facets of healthcare. Not only is it used for reimbursement purposes, but is also used by statewide registries to track disease processes and treatment, for research purposes such as pharmaceutical companies and governmental programs, by vendors to improve medical equipment, by hospital administrations to determine revenue-generating trends, and to improve overall services provided by medical facilities, just to name a few. It's important to realize that as a coder, you are impacting a great many processes, although it may seem you are simply placing numbers in a computer or on an abstract. So here's another question. Why is it necessary for coders to have a knowledge of anatomy and physiology, disease processes, medical terminology, laboratory values, pharmacology, and surgical procedures? Well, coders must extrapolate and analyze documentation in the medical record, and all parts of the record must be reviewed. Therefore, a vast knowledge of medical terminology is expected in order to choose the correct diagnoses and procedure codes. It's important to know what tests might be done in order to diagnose a patient. It's also necessary to know what drugs and treatments are associated with a specific diagnosis, because those secondary diagnoses that are currently being treated are coded. Anatomy and physiology are critical to the coding process, especially when coding procedures. While reviewing an operative note, it is critical to know the location of certain organs, ligaments, and muscles in the body so that the correct procedure code is chosen. Okay, and our final question. What are the implications of changing from the ICD-9-CM system to the ICD-10 system? Well, consider the education that will be needed for clinicians, insurance companies, and physicians, not to mention coders. Software programs such as abstracting systems, encoders, and auditing programs within hospitals, physician offices, and insurance companies will need to be updated. Quality checks will be increased to ensure data are accurate for reporting and reimbursement purposes. All three of the above implications will lead to a tremendous financial impact on all who are involved in healthcare. Now, what other factors should be considered? Well, the effects that implementation of ICD-10 will have on reimbursement. Several training issues need to be addressed with billing and accounting. Capital expenditures such as new or upgraded hardware, software, and training costs for both information systems and coders will need to be looked at very closely, and a large amount of money will need to be spent. It can be expected that there will be delays in third-party payers, as they too will be learning and implementing a whole new system and will encounter the same challenges along the way. Unfortunately, it may also lead to more denials and rejections due to inadequate coding, reporting, and software glitches, and etc. Finally, the MSDRG and AP systems will have to undergo major reconstructions as well. Both systems will require re-engineering of decision trees and logic, which will be quite an undertaking for governmental agencies and private insurances.